In terms of gratification behavior, I mean, do you see those as well?
Yes, we do see a few, not very often, but we do see a few gratification behaviors. A few of which are again a normal part of exploration of their body and self, which is seen towards the toddler age group. Whereas most of the other behaviors which we see at a later age, one in neurotypical scenarios, yes, where they start experiencing pleasure and they start having these repetitive movements. We do often tell the parents to try and distract the child and prevent such behaviors from happening. Two, we also see that sometimes as a regulatory mechanism, which means the child is overexcited, overstimulated, watching the screen, and they don't know how to express themselves. They resort to gratification behaviors. So that's again another way of helping the child understand how to emotionally express themselves, but not link it to gratification as an entity. So again, the parents have to make that conscious, supervised screen where they're engaging with them, trying to help them, trying to say how else they can express themselves. To it could be clapping, or it could be jumping together, or it could be engaging in activities where they share joy rather than going into such
Till
self-stimulatory
what
behavior.
age can you accept this happening? I mean, there are some cases where they report it continuing till when they're older. Obviously,
Yes,
they're not old enough to call it masturbation, so they don't
yes.
have the maturity for that. And it's not a sexual act, but it is more like stimulation, sensory, I mean, pleasure from it. So that's why they call it gratification. So till what age can we take that as gratification, and when does it move on to pathological? I mean, at what age, or is it defined by age, or just the scenario?
It would be more by age, understanding developmental age per se, usually up to about 4, 4.5, or maximum even until 5. But because beyond that, the child has a social understanding as well. They start understanding appropriate, inappropriate behaviors, or they start understanding perspectives, at which point they go beyond uh, not having to do it consistently. But if a child continues to do that even beyond that, even like say 6, 7, 8 years, like you rightly said, then possibly it's important to understand, one, developmentally are they at that age, or is it a child who has a global delay developmentally at 3, 4 years, and this is where they're experiencing the self gratification, or they're trying to figure out their body and so on. Or two, is there any associated developmental condition, because we often also see children with cognitive delays, intellectual disabilities, or autism can also tend to have these behaviors because of the social deficits. Then that needs to be catered to as well.
And probably, I mean, we need to consider child abuse to some extent as well. I mean, it can come from a friend or a relative who has close contact, may not be someone you expect, but if
Yes.
a child keeps doing that, maybe we have to keep that, and some behavioral therapy could help, right?
Yes, definitely. Yes.
Okay.